Yes, good afternoon. Good afternoon. I am from Darjeeling, Sopan Kumar Pal, charity care medical gerontologist. Especially, I'm handling of the quality life of the seniors people. Actually it is the geriatric people is that. Welcome.
Thank you so much, sir, for joining in. Welcome to all of you in our 16th webinar under the Healthcare Insight series of Healthcare Sector Skill Council, which we regularly conduct on monthly basis in collaboration with the industry people, industry experts, for bringing out very important and niche topics for awareness purposes, for skilling purposes, for upskilling purposes. Very brief, Healthcare Sector Skill Council is an organization. We are the awarding body under the Ministries of Skill Development and Entrepreneurship to implement Skill India mission in the healthcare sector. And with us, we have many august audience, many stakeholders which join us, the training partners, trainers, assessors, students, industry partners, government policy makers, and many other kind of stakeholders are party of HSSC. Today, we have an esteemed expert from an organization called Banchbo Healing Touch Foundation, Dr. Dhiresh Kumar Chaudhary, who is a renowned geriatrician and general physician by profession, have been involved in treating the elderly for more than a decade. And very proudly, he's a founder and director of a registered NGO, Benchbo Healing Touch Foundation, which is a pioneer of geriatric home-based healthcare initiative in East India since 2007. He is also associated with in many forms with Geriatric Society of India and many various important organizations and associations. Received various international and national recognition for outstanding contribution in geriatrics and social activities. With this immense expertise and experience, he is bringing out today's a very important topic, immunization, a protective measure for seniors. For all elderly people, what is the importance of immunization? We all think immunization and vaccination is important for children, and we all parents are well aware and getting aware with the universal immunization program and giving our children the immunization at right time. But very important topic that it is also playing a good and important and pivotal role in the life of seniors for preventing diseases which can occur in at the age at a very vulnerable age where they really need a care from us. Welcome, Dr. Dhiresh Kumar Chaudhary, and thank you so much for bringing out this very important topic.
Thank you, Dr. Megha, for this nice introduction. And welcome all the participants who have participated today in this webinar. And it's my second time I am presenting this web series as a guest speaker. And obviously, thanks to the Healthcare Sector Skill Council for giving me this prestigious opportunity, and not only to deliver this important topic, but also to interact with the many of the participants from the different corners of the country. And thanks again, Dr. Meghna, for conducting this is, I think, 16th today. So nicely conducted all the webinar. I have attended many webinar as a participants, and I have learned much more regarding the various aspects of the healthcare sector. So thanks again. And thanks all participants, including my very known Mr. Shopon Pal, who already introduced himself from the Darjeeling of West Bengal. There is a nice geriatric activist. So without wasting time, the very important topic which I've introduced by Dr. Meghna, that we are very much concerned about the. I am presenting here my presentation. So, so I think all of you, you are now my slide is visualized, visible. My slide.
Yes, it's
Hello.
visible. You can go ahead, sir.
Yes. Thank you very much. So today's topic is a very important aspect of the healthcare sector, especially when we are dealing with the geriatric sector or the senior citizen. Uh, Many of participants may not familiar with the term geriatrics, because geriatrics is not so much common familiar term of the healthcare. Geriatrics is the field of medicine where we are dealing with the elderly people. And in India, you know that 60 years and above are considered as the geriatric age group. So different aspects of geriatric age group is there, but today our focus is on the immunization aspect of the geriatric aspect, geriatric people, immunization and protective measure for the seniors. So I'm Dr. Dhiresh Kumar Choudhury. Already my introduction was given by Dr. Meghna. So the next, my just okay. Yeah. Mhm. Hmm. The today's contents of the webinar, first of all, introduction, then principles of vaccination, and regarding the basic about the vaccination, then vaccination scheduled for adults. So that means mainly we are concentrate here in the seniors. Adults means not only the seniors. Adults means well, pediatric age group, beyond pediatric age group. Usually we are considering pediatric age group up to 12. So beyond 12, but here we are mainly concentrating on the geriatric aspect of the immunization. Then the vaccine co-administration, contraindication of vaccination, and the other aspect of the uh, immunization. So introduction to the immunization. Immunization is, what is immunization actually? It is actually the part of the public health tool. It is very much related with the public health, that which we call community health, and as well as individual health. So both aspects, the immunization is very important. And we have faced the corona period, and we know that how effective is the immunization of the community level. So that's why the immunization, the critical public health tool that protects individuals from infectious diseases by stimulating the immune system. Immune system, you know that immune system that protect the body from the different organism which produces infection. And not only that, protect the body from the different aspects. So protection of the body, the system which actually relates with the protection of the body, immune system, to recognize and fight pathogens. So vaccines are actually mimicking the natural infections. Then mimic, and the body responses against this mimic infection to develop the immunity, but without causing the disease. That is the main point of immunization. And this process is very crucial in preventing outbreaks and maintaining the hard immunity. That is a very important aspect, is the hard immunity. Hard immunity means when communities at one entire region of the community, or maybe the localized, maybe even the globalized, that immunities happen among the all people, all population, not only the individual, among the all population, to fight against any infection, like in our corona period, that hard immunity, it's our aim to produce the hard immunity to fight. And you know that India fight this corona infection very effectively, and leading the world by this hard immunity by vaccination scheme or vaccination process. So very important. Then discovered the vaccination, you know that it is not that the vaccination is very new things. It was discovered in 1796. 1796. That means it is more than 200 years ago. Dr. Edward Jenner, that he discovered the vaccination, and I will not go through much more because the time constant is there, because today is the only immunization in the geriatric aspect discussion topic. But you know, all know this man, the Louis Pasteur, and that Louis Pasteur in the 1885 July 6, he first introduced or vaccinated against the rabies vaccine. So the pioneer figure in the vaccination. So actually, what is the goal of immunization, vaccination or immunization? The ultimate goal of any immunization program is the eradication of that disease. Ultimate eradication, but eradication always not possible, complete eradication. Like we have eradicated the smallpox, but not all disease. Polio already eradicated. Some few cases exception there. So, but eradication of the disease is ultimate goal, but reducing the uh, that disease effects on the population globally, from locally to globally. That is ultimate goal of any immunization program. And it requires that infection is limited only to humans with no animals in environmental reservoir and absence of any subclinical or carrier state in humans. Subclinical cases and carrier state, that's also our goal to reduce that, to identify that. And achieving elimination requires a high level of herd immunity to prevent person to person spread. Not only the individual immunity, I have already mentioned, the herd immunity, person to person spread is only possible when herd immunity is achieved. And that also requires considerable infrastructure support to ensure that all risk populations are targeted for immunization. Megha Madam already in her introduction that she mentioned that the immunization, we are very much concerned about the child immunization, the pediatric immunization, the society, the family, all are very much concerned about the child immunization, but we are not so much concerned about the adult immunization, and especially the elderly people, immunization of the elderly people. But maintaining the quality of life in all aspects, that is the right of every person, irrespective of age. So that immunization on the elderly people, that awareness is very important. And for that, HSSC, today there's a webinar organized by HSSC. So thanks again for that, to address the unaddressed, unreached section, especially. So that's the elder section. So another important aspect. Immunization, how can we perform immunization? There are various terms used for the immunization. So I have mentioned, I will not go through much more details, but immunoprophylaxis and immunotherapy, two terms are used. And what is the immunoprophylaxis? Immunoprophylaxis when performed before exposure of the any infectious agent or soon after exposure. So it is called immunoprophylaxis. So it is the main purpose of this immunoprophylaxis is to prevent the infection. But another is immunotherapy. When we use the immunotherapy, it is intended to active infection like or existing cancer-like condition to cure the infection. It is in active side, not in before exposure. So immunotherapy is used in various cancerous diseases, and very effectively immunotherapy is now utilized. So these are the two terms regarding the immunotherapy and immunoprophylaxis. Next, administration techniques. You have to know that those who are not directly from the medical side, so they have to know that how that immunization or the vaccinations are administered. There are different routes of administration. Mainly, we are using intramuscular, like influenza vaccines, pneumonia vaccines. These are intramuscular, means within the muscle. Then there are another way, that is the subcutaneous underneath of the skin, that is like MMR, measles, mumps and rubella vaccine. And another obviously that is intranasal and some immunization process and oral immunization. You have know that India is achieving very much effective goal in to eradicate the polio. So that oral polio vaccine OPV, that oral polio vaccines are the vaccines. The live attenuated influenza vaccine also example of the oral vaccines, and that these are the oral vaccines. So already I have mentioned, there are no, not mentioned. This is the how administration. This is the type of vaccines. There are different modes of vaccine. Actually, we have introduced. We have introduced the vaccines in different form. So we have to know that one of the different form of vaccines we are introducing in any human body to produce the infection. One is the live vaccines. Live vaccine is the attenuated strains which replicate the host. Live means living, living. But you may ask that we are introducing any living things. But that is that attenuation means what? The virus and bacterium has been weakened to reduce the virulence. Hello. Please mute your please mute. So reduce the virulence. That means the effectiveness of the virus that is reduces. That why? Because so it cannot cause any disease in healthy people. So live vaccines. Another is the inactivated vaccines. Inactivated means either suspension of the whole intact killed organism like pertussis, influenza, etc., or the subunit of that killed organism. Maybe it is not live, it is killed. So maybe the whole entire portion, or maybe the subunit we are using to vaccinate. So that is the inactivated vaccines. And conjugated vaccine, some bacteria like Haemophilus, influenza, like Neisseria, meningitis, Streptococcus pneumoniae. In that case, we are using the outer sugar molecules of that so-called polysaccharides. That we are using here only the polysaccharide portion of that bacteria or virus. So that polysaccharide is used as a vaccine. That is called conjugated vaccine. So mainly we are using these vaccines in three forms. One is a live, one is the inactivated, and another is conjugated, only the polysaccharide portion or some portion sugar molecule where we are using that. But vaccines, we have to know the vaccines why we are giving. We are giving to reduce the infection. We are giving to prevent the infection. Infection by virus, infection by bacteria, that organism which produces infection. So in that case, obviously the effectiveness is more. We are expecting the effectiveness, we are expecting the positive outcome of the vaccination. But some adverse events may be happen, but it's not that much more severe adverse effect is happening. So there are very much minor, which is negligible adverse effect, maybe there, which can be easily manageable, but easily manageable, that should be under the supervision of the doctor, not by any non-doctor or non-medical person. So adverse events following vaccination range from mild to severe. Very rare cases, severe adverse effect may be there, but it may be mainly due to our unawareness or without the preparation, without the precautionary measure. If we give the vaccines, that can lead to severe adverse events. That usually not happens. So what are the primary or mild adverse reaction? That is a local reaction such as pain, swelling at the injection site are very common, but very easily manageable. Then the systemic reaction, maybe sometimes that symptoms, maybe they are fever, malaise, that body ache, muscle ache, arthralgia, myalgia, that sort of things, but very shorter period, very easily manageable. But there are sometimes, in rare cases, serious adverse reaction maybe happens. That is we call anaphylactic reaction. So anaphylactic reaction is not only for related with the vaccines, it also related with every medicines. Every medicine in rare cases can cause the anaphylactic reaction. So even not only medicine, some agents may cause an anaphylactic reaction. So anaphylactic reaction is common incident, but it is rare incidents. Common means common in medical science, but it is rarely happen. So in that we require immediate attention to combat the situation, combat this anaphylactic reaction. So that's why I'm here concentrating mainly, or I would like to give advice that all vaccine should be under the direct supervision of any medical personnel and in initial or first dose always by doctors, because if any anaphylactic reaction is happens, it is in the first dose. Usually in the second dose, third dose, it is not happen because body, please mute your Meherun Misha. Please, Meherun Misha, please mute your Uh, so anaphylactic reaction is mainly when that body is exposed to some agents and that allergic reactions, allergic to that substances, and ultimately that leads to anaphylactic reaction in the severe cases. So in that case, it should be combated immediately by giving, usually we are giving the steroid injection, other measures, even hospitalization is necessary, but that's why the supervision by doctor is very important. Contraindication for vaccination. Always it is not that advisable to give vaccination freely. Contraindication is there. That includes when anyone is know that there is a severe allergic reaction in previous time. So we don't give that again. So any include history of severe allergic reaction to a vaccine component. So you have to think that all individuals are unknown to allergic reaction of vaccine, because before exposure, no one can say that I am allergic to that. So that's why in first dose, we should be very much cautious about giving under the supervision of the doctor. Maybe very rare case, maybe 1 in 1 lakh, but that 1%, we should not lose this 1% also. That's why under supervision of the doctor to combat the immediate reaction. So absolute contraindication is a severe allergic reaction. If they are related contraindication means sometimes pregnancy may be, but it is not related in today's aspect, in the geriatric aspect, but sometimes immunocompromised patients, when anyone is suffering from cancerous, but cancer, but immunocompromised state, but that should be under the supervision of the doctor, and doctor may prescribe that yes, then my patient is free to accept that. So it is not that the contraindication, absolute contraindication in the cancerous patient. Sometimes cancerous patients require more immunization effectively to prevent the other secondary infection. So that's why that is the under jurisdiction of the doctor. So that case, or maybe the acute illness. When acute illness is going on, we cannot give any uh, uh, vaccination. Like if anyone is suffering from the flu-like symptoms, we cannot give the flu vaccine at that period. So we should avoid that acute infective stage. And screening of the patient of the contraindication should be done, obviously ensure before giving the safe vaccination practice. Then now we are coming to the geriatric aspect. When the geriatric, we are considering the geriatric aspect, there are different components which we should be emphasis to give emphasis. One is the decline in immunity. Geriatric means there is a decline in immunity. And if you know the geriatric, there are lifespan of 25 to 30, even more than 30. Because now the people are lifespan is even 100, more than 100 is also there. So lifespan it start from the 60. So if we think 85 even, So 25 to 90, even 30. So 30 years or 25 years lifespan. And that is divided into three stages. One is the younger old, 60 to 70. Then in the middle old, 70 to 80. And 80 plus is considered as the older old. So whenever the older old aspect, their decline immunity is much more comparatively the younger old aspect. So this depends on the how much age of geriatric adult because of the much more lifespan, 25 and 30 years span of the geriatric age time. So it depends on the age of that particular individual. So immunosenescence, inflammaging, dysregulation, these are the causes of the decline immunity. They are suffering from frailty. Frailty is very common term. You go through the net and you know that that means the physical deterioration, cognitive decline, and weakened resilience. Means the person is physically very much weak. Physical deterioration is his or her physical health is decline. His or her mental health is decline, as well as his resilience to the productive life that also decline. That is called frailty of the elderly. And elderly infections are very common, mainly the influenza, pneumonia, shingles, but the other infections are there. They are very much prone for the infection. For that very three reasons, that vaccination of the geriatric age group is very, very important and effective tool. So that's another boosting immunity, preventing elderly deaths. We can, by vaccination, we can reduce the mortality and morbidity. Morbidity means the disease producing, the rate of the disease producing rate, or mortality means death, rate of death. So we can reduce both rate, we can reduce both disease. Okay, so that we can prevent by this vaccination, minimizing the serious complication. It's all, and it is not that if we give vaccination, we can 100% reduce, prevent the infection. Okay, it is not possible, except some. Oppo A52, please mute your. So minimizing serious complication that I am discussing, that it is not that conception is there if we give any vaccine that is 100% preventable. It's not that, except some like polio that is 100% if we give the 100% preventable. But we can achieve 70% to 80%. That is very important. Why not we are targeting that 70 to 80%? It is not a low percentage, it is a very high percentage we can prevent. That is another very important factor. Another factor is the serious complication we can avoid. Maybe the disease is there, maybe influenza is there, but very mild. Maybe pneumonia is there, that is very mild. It is not required for hospitalization. We can prevent the hospitalization. We can prevent the invasive intervention that can produce that can possible by vaccination. So that is very important. And if you love your seniors, the protecting the loved ones, that is the also your the dignity, love, affection that can be possible indirectly or passively by vaccination. Because if we give vaccination, their quality of life will be increased in the physical aspect as well as mental aspect. So they will lead the productive and colorful life. So of everyone, we obviously we are thinking our elder people to live more productively. So that's very important. So that I have mentioned immunosenescence, the need of the elderly, increased risk of different diseases, preventive strategy, prevention, and prevention. It is not only in the child age group. It is more effective even in the senior age group also. So we can prevent the disease, and the prevent of the disease can be possible by vaccination. And I have already mentioned, reduce the complications of the diseases maybe happen, But complication of the diseases, that can be reduced by vaccination. But there are some challenges. First of all, challenges is lack of awareness. So those who are attending today's this webinar, your duty is to propagate this among the society, among the family, wherever you are located, that every senior citizen also needs vaccination. So that awareness is very important. Only because of the lack of awareness, the majority of the seniors are not vaccinated till today. So that's why this is the very important message. Number two is access and affordability. Obviously, vaccinations are there, but these are not accessible, especially for the marginalized section, peripheral section, the geographically marginalized section. So that is one thing. And affordability is a very important question. So affordability, because of the BPL society, marginalized society, they cannot afford that. So that's why government of India is also trying to introduce some vaccination in their elderly schedule. But we have to think many organizations should come forward to combat this, to give these NGO-ized organization should more proactively do that. And vaccines effectiveness also very important. Sometimes may not be so much effective like longer, but obviously it's not the factor to not propagate this, because that 70% effectiveness, 80% effectiveness also very, very effective for the elderly age. So that recommended vaccine. Now the question is, what vaccines are recommended for the elderly age group? There are several vaccines are there, but mainly we concentrate 3 to 4 mainly. First is influenza. It is the annual flu shot is recommended for an only annual one-time recommendation of the influenza vaccine to produce the immunity against the influenza. Influenza is very commonly happened by influenza virus. The like very common flu-like symptoms. We are suffering from common colds and flu-like symptoms. Many of the season, because now seasons are also unpredictable. So that seasonal changes, we are suffering from that. But in senior aspect, especially those who are suffering from different sort of comorbidities, they are very much prone for that, and that causes even severe complication. Simple influenza can produce severe complication to the elderly, and that can lead to hospitalization also. So by receiving this influenza vaccine, we can prevent that. That's a very important. So another again, important is the pneumococcal. In globally, mortality and morbidity of the elderly is because of the higher risk of this pneumonia. Pneumonia, you know, that affected the lungs severely. And in pneumonia vaccine, it's a serious infection, a pneumococcal vaccine, pneumococcus bacteria. It is recommended at the age of 65, one-time vaccination. First, there are actually the regime is there. I would like to come later about the how you give the pneumococcal vaccine. So second is the pneumococcal. Third is the herpes zoster. Usually herpes zoster, herpes infection shingles. These shingles vaccines recommended healthy adults 50 and older, given in 2 doses. It is very much effective to preventing the shingles or herpes infection. That is a very, I have seen in my patient severe complication of the herpes zoster infection, severely affected. And the very important one thing is the herpes is cured, but post-herpetic neuralgia, that is the pain, severe pain in the affected part, nerve pain. So that leads to what? Reduce the quality of life severely in the elderly person. But elderly persons are prone to herpes zoster also. So to prevent that, herpes zoster or shingles vaccines, that is the third vaccine. Another is the Tdap or TD, that is tetanus, diphtheria, and pertussis, which is recommended at least every 10 years. We have to give this. And tetanus, you know that tetanus, we are very much concerned about this tetanus vaccine. Every time any injuries happen, we are giving tetanus. That is not required at all. Okay, every time in injury, tetanus vaccination is not required. But we have to think that the elderly is vaccinated at least for last 10 years, tetanus vaccine is received. That tetanus, how we to give tetanus, that is also depends on the quality of the injury. If the severe injuries happen where exposure is much more, bleeding is happen, okay, and lesion is much more area, that may needs to 5 years also. If 5 years within there, it may not be required. Even that depends on the concerning doctor also. But usually our recommendation is every 10 years you have to give that tetanus, that is the elderly individuals. COVID-19, where you know that and respiratory syncytial virus, that respiratory virus that we are giving this sort of vaccination also, but these are not so much common. COVID-19 already, you know that many of our senior citizens already received this COVID and completed their full doses. And other vaccines, depending on their travel, depending on their occupation, depending on their chronic condition, maybe some common is the hepatitis A, hepatitis B, meningococcal diseases, that vaccination we are giving. If those who are even working, even that I have mentioned the younger old age group, even 60, 65 years, they are working in the healthcare sector, may be exposed to the that contacts of the blood contacts, and that's possibilities are there. So they should receive the hepatitis A, hepatitis B, that sort of vaccine. So mainly influenza. Number two is the pneumococcal. Number three is the herpes zoster. Number four, Tdap and TD, and then again different sort of RSV, COVID-19, hepatitis A, hepatitis B. So highly recommended vaccine for in the day is flu vaccine once yearly. Then pneumococcal vaccines. There are till now, the last August in India, two strains are available. One is the PCV13 and another is PPSV23, two strains. Usually, the 1 year gap, we are recommending that first we should receive, if no one is vaccinated before, then after 65, usual recommendation is receive PCV13, then after 1 year, receive PPSV23. Usually, in the recommendation by different medical organizations, including the Geriatric Society of India, usually that not needs any further booster. Now, from this last August, there are one vaccines launched in India, even in America previously launched, but India now new in India, that is, kya ho raha hai? Why are you this giving love sign? You know, very much pleasurable, but in the screen it is not advisable to give the love sign. Okay, so PCV20, that is the pneumococcal conjugated vaccine 20. That is very important and very advantageous also. Why? Because these needs only single shot in lifetime. Anyone can receive even after 50, that also receive, but in the elderly age group, if anyone receive PCV20 one time, it's a lifelong vaccination that not need any further taking any pneumococcal strain. So that is a very important. Then the shingles. Sajan Kumari, just please mute your those. In participant, yes, thank you. Shingles vaccine, 2 doses required, 2 to 6 months apart. Shingles, that is already mentioned, herpes zoster, and Tdap vaccine, 1 dose in every 10 years. These are the highly recommendation for the elderly age group. And there are different aspects also, not only the age, but also travelers, seniors, those who are travels frequently, they need some special recommendation. Sedentary seniors and seniors with incapacity, those mainly in the super aged person, those mainly suffering from many sort of comorbidities, they need much more vaccination compared to other, but every senior individual needs minimum these 3 vaccination One is influenza, another is the pneumonia, and third is the herpes zoster. Then senior in the institutional setting, that also in admission time, we have to think specially when there are operable cases are there, then need surgical intervention. When injury is the cause for the hospitalization, in that case, we should query about the tetanus vaccine, when the tetanus vaccine received tetanus, that status of the tetanus vaccine. That is also important. And in any cases where previous history of hepatitis, okay, liver disorder is there, that we require to know that the hepatitis vaccination, about the status of the hepatitis vaccination of that individual also. So now the individual vaccine, influenza, fifth leading cause of death in people over 50, vaccine efficacy, like more than vaccine efficacy. Even the elderly are that vaccine efficacy is more in the elderly compared to the younger. 38% is efficacy compared to children. That is 38% than 23%. Coherence database revealed that 31 studies shows 80% efficacy. 80% efficacy. I have heard when initially I have mentioned that vaccination produces efficacy 70 to 80%. Here, influenza vaccine produces 80% efficacy in preventing influenza illness in healthy adults. So this is very important. Influenza vaccine problems, actually this needs annual vaccination. Why? Because of the new strains in every year, new strains are there. In India, commonly July, August, September, October. These are the very commonly we have given this in the monsoon season. Before starting of the monsoon season, we are usually we are providing the influenza vaccination. We have northern hemisphere. There are two forms of influenza vaccine. Those are in the northern hemisphere, and one is for the southern hemisphere. But we are considering the northern hemisphere vaccination of the influenza vaccines. So new strains, viral grade, age-specific responses, and there are some problems, but these are not so major problems. Then pneumococcal vaccine. I have already mentioned there are two strains of pneumococcal vaccines still now they are available, except that newly come 20. So 23 valent polysaccharide vaccine, 13 valent conjugated vaccine, which shortly termed as PCV, pneumococcal conjugated vaccine 13, and PPSV, pneumococcal polysaccharide vaccine 23. These are two available vaccines, but from the August 2025 this year, 20 PCV 20 is available for the pneumococcal aspect. It's not that the previous ones are ineffective. No, previous ones are also effective. But if anyone can afford, they can give the only one shot of PCV 20 to avoid any further vaccination. So that's if any individual we like to give any senior person in the pneumococcal vaccine, first we should introduce the 13 vaccine, if not vaccinated before. So 13 vaccine, then after 1 year, we have to give 23. But if PCV 20, slightly costlier, but it is affordable, not that not affordable. So PCV 20, if anyone, only single shot. That is important. Another important factor, sometimes some immunocompromised patient, some chronic disease like chronic renal failure patient, they need, if 13 is given, after 8 weeks, we have to give that 23. They need much more earlier, the 23 than normal. Okay. So that is, another is the herpes zoster, the chickenpox virus, varicella, that is the DNA virus. 1 in 3 persons will develop shingles in their lifetime. 1 in 3 persons will develop shingles during a lifetime. So the very common infection, and very common infection not only in the child age group, even in the elderly age group. Cell-mediated immunity is the major determinant of the incidence. Immunocompromise, I have mentioned that those the immunity level is low, that can produces that they are very much prone for the herpes zoster infection in the elderly age group. So that, and usually this is nerve root related infection. that virus causes a single nerve root. So that's why the unilateral manifestation. So that can usually trunk the fifth cranial nerve. That is also very commonly affected. And I have mentioned earlier also that post-herpetic neuralgia, that after that infection, that neuralgic pain, nerve root related pain, the severe, that is even persisting for 1 year, more than 1 year, even after 5 years also, that neuralgic pain is there. So for the elderly aspect, it is very important to prevent this herpes zoster infection by vaccination. But it is less effective if we are giving after pneumovax, that PPSB 23, if we are giving within 4 weeks of this herpes zoster, it may be less effective. So it's not required to give alongside. Time is there. So after passing the 4 weeks of pneumovax, we can freely give herpes zoster. So associated with aging, already mentioned, this is not required. Herpes zoster vaccine contraindication, with similar type of that contraindication in every vaccine, that is the vaccine components if they're allergic. So gelatin, neomycin, this sort of severe allergic reaction. Pregnancy is the contraindicated here. In elderly age group, it is not related, obviously. Immunosuppression, immunodeficiency, tuberculosis, active untreated tuberculosis, where we cannot provide herpes zoster in that period. So precautions, if any person, any elderly is suffering from moderate to severe acute illness, and that time we have to avoid that period. Current treatment with antiviral drug, if anyone is suffering from any other viral disease, and if antiviral therapy is going on, we should avoid that period. Obviously, I have mentioned that when we have to provide that suggestion, that is the jurisdiction of the treating doctor. So that is the discrimination of the doctor. That doctor decision, it is not your decision when you should give the vaccine. So that it is not when current treatment, obviously doctor knows the antiviral treatment is going on. So they obviously avoid that time for the vaccination. And immune modulators and recombinant, some immune modulators, if they are under treatment of some immune modulators, and that it is also contraindicated, but it is under the jurisdiction of the doctor. This is the pneumonia, influenza. The picture is not required, but it is your aspect. Given this picture to visualize this, for to know what sort of lesion is there manifested during this herpes zoster. This sort of lesion, blister-like lesion, if developed, you should be cautious. Okay, you don't think that it is okay, allergic, or it will cure naturally. Nothing is required. So if that sort of things are developed in any human body part, okay, in the age group, we should be cautious. We should consult doctor. If is it the herpes zoster or not? Obviously treatable. Obviously it is the antiviral therapy is required. Some other precautionary, some other measures are required. Even analgesic required. Even some sort of neuralgic to prevent the neuralgic pain, pregabalin, that sort of medicines are required. But that is by the doctor, but we have to consult them. But in that active period, we should not give any that's vaccination. Vaccination is before exposure, but just for your knowledge. So this is very important. Even that can lead to, I mentioned that can lead to ophthalmica in eye. It is involved in the eye also. So especially in the elder age group, I have seen 2 to 3 cases of my patients where herpes zoster affected the eye. So that's, and another, the hepatitis vaccine. I have already mentioned the influenza. I have already mentioned the pneumococcal. I have already mentioned the herpes zoster. Then the hepatitis B and A vaccines. these are common. Hepatitis B exposure is every individual can expose hepatitis B if that sort of any chances are there, like blood transfusion, that shaving in your saloon outside. Okay, so in that case, so this sort of hepatitis B vaccination, elderly age group, they are even elderly aged people are shaving in the outside saloon. Exposure may be there. So that's why. So hepatitis B vaccine, usually 1 ml vaccine, recombinant vaccine administered in zero, and that one which day you are giving, that is zero considered. Then in 1 month and 6 months interval, that intramuscular, you have to give this hepatitis B vaccine. Hepatitis, there that the hepatic means liver. This is a severe liver disorder by viruses. There are different sorts of hepatitis viruses from A to E, but mainly we are commonly exposed to the hepatitis E, but hepatitis B, E vaccines, these are very alarming. Hepatitis A and C mainly. So hepatitis B vaccine, B viruses when produces, that can cause severe hepatitis, and that can lead to even the total complete failure of the liver. Even ultimately in the later stage, that can lead to cirrhosis of liver. So that's why we have to, if any chances are there, we have to prevent that by giving this hepatitis B vaccination. So the doses are zero, then 1 month after that, then 6 months after that, intramuscular injection. And CKD means chronic kidney disease, the need for booster dose. Usually, except CKD, another further booster dose is not required. Hepatitis A vaccines, very commonly what we call, common people are called jaundice and suffering from jaundice. Jaundice is actually not a disease. Jaundice is the symptoms. Jaundice is the symptoms of when our bilirubin level is rises in the blood more than 1, clinically manifested. Okay, so hepatitis A, the usual infection by the hepatitis A virus is the hepatitis A. And in that, to reduce that, to prevent that, hepatitis A vaccine is also there, inactivated vaccine. Schedule is 2 doses of 1 ml vaccine intramuscularly, 6 months interval. First dose, then after 6 months, second dose. Okay, so important aspect in the elder aspect is I mentioned what are the different vaccination for the elderly, but patient barriers is the main obstacles in providing the vaccination in the elderly. First of all, there are fear of misconception among the elderly. Even that sort of conception is there. Oh, if I have received that vaccine, I may be infected. So that sort of vaccination commonly in the villagers. It's not that the villagers means because they are not so much educated. Okay, not so much aware. But it's not that only in the villagers, even in the urban area, people are misconception is there, fearness is there. Lack of recommendation, usually not recommended. Even I have to mention that physicians are also not recommended the elderly vaccination is available to their elderly patients. So it is our duty. It is the duty of the doctors. It is the duty of the healthcare personnel, those who are related with the geriatric care, like Mr. Shopal, geriatric care, his very much geriatric activist. So this sort of person, even you all participants, those who are attending today, it is responsibility of every participant to propagate this. Vaccination is available for the even elderly person. So recommendation is very important. Accessibility, especially for the marginalized people, especially for the geographically non-reachable or unreachable or geographically challenging sites, here, villages, that the awareness and along with accessibility and affordability, that is very important. And organization like our organization, we are promoting this Masbo, that our organization NGO is there, Masbo Socio-Cultural Association. Our Geriatric Society of India, they are very much actively propagating this adult vaccination among the whole India. Pan-Indian activities are going on. So all other institution, hospital, NGOs, private institutions, corporate hospitals, all require in these active movements. And I have to thank again to the healthcare sector skill council because they are arranging this a very important topic webinar on this very important topic. This is one way of propagation also. So vaccine co-administration is another one. We can co-administer vaccine. It's not that every time in a vaccine separate type of vaccination should give in a separate time. Some vaccination we can provide. It is especially why, because in elderly persons to lose the time, prevent to lose the time. One, and it is your what policy wise it is easy. Okay, logistic wise it is easy. Okay, because if home care is available, if anyone is give this vaccine to the their home, okay, but every senior citizens are not getting the home care service. Home care services are very much confined in the some places of the India. Okay, especially they are in the urban area. So, senior citizens to go to the chamber or doctor's chambers or hospital to receive this vaccination. So, if it is possible to give two vaccines in the same sitting, it is easier. For that aspect, co-administration is possible, like in the influenza and pneumonia. In single sitting, in a single day, we can provide influenza vaccine along with the pneumonia vaccine. In our elderly member of our organization, we have given many more elderly the two vaccines in the same sitting, nothing happened. So no fear, no misconception. So that can be possible. So this is the example for administering influenza pneumococcal vaccine in the same city. But we have to think that special precautions are consideration for the adult vaccination. First of all, why special considerations is required? Because we have to know that, and we know that actually, that adult persons are suffering from many sorts of infection. They are prone for many sorts of infection. They are suffering from many sorts of your diseases, what we call because of their degenerative changes in their body, their decaying body, degenerative changes. So that causes the chronic diseases. That chronic diseases are lifelong. It's not that chronic disease is a short-term disease like hypertension, like diabetes, like chronic obstructive pulmonary disease, like osteoarthritis, like Parkinson, like dementia. That sort of these diseases are there. So they are suffering from many sorts of chronic diseases. And because of the chronic diseases, they are receiving many sorts of medication. That medication, the very one common term is used for the elderly aspect, that is called polypharmacy. Polypharmacy, poly means multiple. Pharmacy means related to the medication. If any individual is receiving more than 4 medicines, they are under polypharmacy. But polypharmacy is very common in elderly age group. Sometimes their physical condition needs to take more than 4, there's 5 and more than 5 medicines. But sometimes, because of the unawareness, they are receiving that. I have seen many of the elderly patients, they are receiving, reducing the acidity, that antacid we commonly term, 2 to 3 antacids. They don't know they are receiving 2 to 3 antacids by 2 to 3 doctors prescribing antacids because they are complaining this acidity problem to the every doctor, and every doctor are giving this. So regulation of the prescription is also very important. They are taking multiple multivitamin 2 to 3 times. Even I have seen many educated, highly educated senior citizens. They are receiving medication, similar sort of medication 2 to 3 times. So these polypharmacy is a very important factor. So in that case, because of the multiple comorbidities, because of the polypharmacy, because of their physical constraints, because of their degenerative changes in the every system of the body, and age, obvious. Age itself is a risk factor. Because of the frailty, they are very much prone for the infection, prone for a very common infection like influenza. Many people are suffering from influenza very frequently, even after curing the influenza 10 days before, again they are infected. I've seen it. So we have to think seriously. And in that case, we have to give vaccination if that is preventable. But that vaccination, some requires consideration, like immunocompromised individuals, those who are suffering from very rare or HIV or undergoing chemotherapy for cancer, they can require modified vaccine schedule under the strong jurisdiction or supervision of their treating doctors. Here, the pregnant woman is not prevented, but due to their declining immune function, it is not that freely we can give medicines to every adult human being because they can affected by even the vaccines also. But it is not that if we take precautionary measures, if we avoid all sorts of contraindication, if we know that how what may be the adverse effects that can possible, if we prepare for to combat that, if any vaccination is given under the direct supervision of the doctor, this can be prevented. So that's why this is very important message for the elderly. Thank you. So I have tried my level best to complete this vaccination in different aspects. I think you all have enjoyed. If anyone have any question, you may ask.
Okay,
Dr.
thank you. Thank you very much, Dr. Choudhury. Last
Dr.
1 hour.
Just interrupt you, Mr. Paul. Just interrupting you because the moderator, Dr. Meghna, is there. Hello. Hello.
Yes, Dr. Dhires.
Yes, yes. Madam. It's up to you, madam. I have completed my presentation.
Thank you so much, Dr. Dhires. Thank you so much. If anybody has some queries, do you want to ask some questions? So please do chat. Please use the chat.
Okay, already I sent two questions. One, live attenuate vaccine and the inactivated vaccine. Okay.
Right. So,
Can,
yes.
So what are you
Dr.
asking?
Dhires,
That? What is
Dr. Swapnan Pal has asked that if what are the types of live attenuated vaccine and what are the types of inactivated vaccine? If we could enlighten in few words.
I will go through that previous. Here the mentions that live vaccines means it's living vaccines, living that organism we are giving this as a vaccine, but their attenuation means their virulence, the infective power that is weakened and reduced. After that, then we provide this live vaccine so that it cannot produce any sort of your diseases. And inactivated vaccines means when we are producing these, we are giving this vaccine in a kill form that even whole body part, whole intact kill organism we can provide, or we can provide the acellular in a subunit portion of that. Okay, like in acellular pertussis vaccine, that we can provide that acellular part. Or we can provide the whole body part like in influenza, rabies, in that sort of thing. So this is the basic difference. One is the live, another is. And any other further question?
Thank you so much, Dr. Dhires. I think so. There is no further question. That was really insightful, Dr. Dhires. And thank you so much. All the webinars, your topics are always very insightful and really excite us to actually go forward right now and right itself, that we can see the dedication you have in the care of the geriatricians. In the care of the geriatrics. Thank you so much.
Thank you. It's my obviously honor, and you are giving this opportunity to me to interact with the people from the various corner of the India. So that's a very great opportunity for me also. So I'm really honored. Okay.
Thank you so much. Thank you so much, Raghundesh. Thank you so much, all the audience, for your the great audience for patient hearing. I hope you have understood many things and you would be able to apply this in your daily practices. Thank you so much.
Your next any your schedule, madam?
So next month it would be scheduled. So very soon we would release the date for the next webinar.
Okay. So I would request every participant, those who have attended today, also participate in coming that on their web series, because these all topics, whatever was discussed and whatever will be discussed, are very effective for the every individual, especially those are by any means related with healthcare. So this is very important. Thanks to HSSC for their
Thank
arrangement.
you so much.
Thank you.
For keeping yourself updated, you can follow our Facebook page, our YouTube channel, and our LinkedIn page, where we keep on updating the upcoming webinars and also upload the recorded webinars on our YouTube channel, and also post it on our Facebook and the LinkedIn page. You can use that. You can hear the webinar again for any informations. Thank you so much.